Hi, I'm Dr. Arun Rao, Medical Director of Care Coordination for Penn Medicine Princeton Health. I'm board certified in internal medicine and geriatric medicine. My primary area of focus is the care of older adults. Today, I'm going to talk about the impact that even a short hospital stay can have on older adults and why some patients recover better at home rather than at another facility after being discharged from the hospital. A hospital stay can be challenging for anyone, but for adults aged 65 and over who are recovering from an illness or injury, the decision of where the patient will continue to recover once they have been discharged is an important one. For many patients, returning to their home after a hospital stay offers recovery in a familiar environment where getting back to the activities of daily living can offer a faster return to strength and peace of mind. Even a short hospital stay can have a significant impact on many aspects of an older patient's health. In fact, older adults can experience a variety of effects when they're in the hospital, including a sudden change in mental health, known as delirium, a decline in physical strength from immobilization. A psychological change can be experienced as delirium, which often includes inattention, restlessness, disorientation, and incoherent thoughts and speech. This can be caused by the acute illness itself, new medications, or recovery from anesthesia. The anxiety that some patients experience because they're in an unfamiliar environment and out of their daily routine can also contribute to changes in mental health status. During a hospital stay, the decline in physical strength can be the result of not being involved in activities of living such as bathing, cooking, and household chores, as one day spent in a hospital bed is often equivalent to 7 days of strength lost. These situations can have a lasting effect on the patient, so the multidisciplinary team at Penn Medicine Princeton Health begins evaluating each patient the moment that they're admitted to Princeton Medical Center. Together with physicians and nurses and experts in physical, occupational, and speech therapy, the case management team conducts a comprehensive health assessment that considers the patient's nursing needs, functional status, available and able support network, and goals for care. Members of the team also speak with the patient and their loved ones to learn more about the patient's life outside the hospital so the team can recommend the best plan of care after a hospital stay. Concerns in any of these areas that might make discharge to home difficult might result in the option of transferring to a skilled nursing facility, perhaps even on a temporary basis. The period of recovery after an older patient is discharged from the hospital can be a difficult emotional time, and you or your loved ones may face the often challenging decision of whether to return home after a hospital stay or to go to a skilled nursing or other type of care facility. It's important to understand that for many patients, discharge to home offers the best opportunity for a more comfortable recovery and a faster return to normalcy. If you or a loved one experience physical deconditioning in the hospital, you can regain strength sooner when you get back to a normal routine that requires you to be mobile and active. Your nutrition also tends to be better as your favorite foods are available in your home. If you or a loved one have noticed psychological changes during a hospital stay, returning home can offer immediate relief from the fear and anxiety that can often come from spending an extended period of time in inpatient care. There are many aspects of your care and recovery to consider, however, when you're exploring the option of returning to home. Even after discharge from the hospital, you may require physical or occupational therapy, speech therapy, or medical equipment such as a bed, wheelchair, shower seat, or walker. An older adult who is returning home after a hospital stay will also require a safe environment that's free from tripping hazards and matches their reduced physical abilities. You and your family must also evaluate whether help with cooking, cleaning, bathing, wound care, medications, and the like will be needed. For some patients with complex medical needs, discharge to a skilled nursing or long term care facility may be the best option. A skilled nursing facility offers various levels of care, from a period of recovery and rehabilitation until the patient is ready to go home, to long term and hospice care for patients who aren't able to return home. Some patients may also face concerns with health insurance coverage, lack of a support system to help ensure that they are safe in their home, the ability to take their medications as directed, and follow up with their physician. The key to a successful return to home is planning. There are many things that may influence your choice, and support from family, friends, and others in the community are important. If recovering at home is determined to be the best option for the patient, working closely with the experts at Penn Medicine at Home or another home care agency of the patient's choice, our team will provide guidance about the equipment and services that will be needed in the home, what may be covered by insurance, and what local resources may be available to help fill in the gaps. Conversations about your wishes for medical care can be difficult, but it's best to have them before a medical crisis happens. For the patient, it's important to voice your desires and concerns so your needs are regarded by your family and care team. For family members, it's important to ask your loved one what matters most to them and to better understand the environment in which they'd be most comfortable recovering. No matter your role, be proactive. Work with family members to review and prepare your power of attorney for medical and financial matters, living will, or advanced care directive. You should also review insurance information so everyone understands how to proceed. Princeton Health also recommends talking to your primary care physician about completing a physician orders for life-sustaining treatment, or POST form. If you aren't in the hospital and aren't able to communicate, the POST informs providers about the treatments you want and your goals of care. No matter the challenges you or your loved one are facing, the team at Princeton Medical Center will listen to you and offer you expert guidance and compassionate care.